Hi, everyone. Let me go through the questions, answers, and rationale for the first exam in our healthcare ethics class. I'm going to spend a little bit longer just talking about the rationale as well. And as I mentioned in class, this YouTube video will be up on the Blackboard site the whole semester. So let's start with the first question having to do with the grand round scene in wit. How does Vivian's experience reflect a key ethical tension here? I'm going to just move this around. There we go. So really encourage you to highlight what you think are the most important parts of the question here. Key ethical tension in clinical education and patient care. And obviously this has to do with the grand round scene. So in some of these responses, you have to go deep, right? You're always looking for the ethical issue, and you really need to look at your notes here. So, but in some of these responses, there are two potential answers. If you choose either one, that's fine, but it's the rationale over here that matters. Um, in terms of this one, either B or D are correct because it highlights the notion of loss of dignity. You can think about the grand round scene, ethical conflict between medical training and patient care. The other part is she remains indifferent to the clinical setting. She's a passive participant, especially in this example of the grand round scene. So now in here, as I've recommended, you don't need to retell the story of the grand round scene. You do not need to say, well, they walked in and they didn't introduce themselves and they lifted up her gown. You do not need to do it. You need to go right for the issues. In both of these, either B or D, lack of professionalism or lack of demonstrating how the patient healthcare professional relationship can be seen. Really, also, another potential example did not really value her autonomy, did not value her autonomy. Now, I'm sort of writing this in code, but you could choose either of those things. Now, this and this and this, we talked about those things. They are related to the ethics themes or the sub themes. So, what you choose and how you do it is up to you, but you don't need to retell the story, but you do need to emphasize the issue. Okay, let's keep going. This has to do with John Donne's Holy Sonnet. In what way does the final line of the sonnet reflect Vivian's ability to navigate her illness? It's not just the final line of the sonnet, but how does she navigate her illness? And really, the response has to do with the end. How does she make choices? You do not have to be a student of 16th century poetry, but what does she do at the end? She elects to implement a do not resuscitate order. If you remember the scene with Suji, she says, I want to be DNR. What's the ethical issue is she decides it's her choice on how she dies, but more importantly, she's exercised her autonomy and agency. Okay. So basically, mentioning those things is key. Now, you can put choice, that's fine, but she makes that determination. Death, thou shalt die, the final few words of his, death, please die, which means I am making my choices. Now, you don't even need to know that. It's just how does she navigate her illness? Okay. It's always related to the ethical issue. Let's talk about number three, Madison. Okay, so she goes to the emergency department. She's 18 years old, so she's age majority, but she passes out, so her friend Ella has to bring her in. But here's the question. What am I doing here? Can't see this. Question, how do I get to my stuff here? View, draw. There we go. Sorry. Question, what's the most appropriate course of action regarding the informed consent process? Regarding the informed consent process, okay, so which one of these makes the most sense? Madison is unable to communicate. She can't give informed consent, okay? They can't reach her parents, so they can't say, yes, Madison consents. She has a fractured leg. Okay, that means she's in pain, even though she's passed out. She's probably passed out because she's in pain. Where does this occur? It occurs in the emergency department. So when it comes to the informed consent process in the emergency department, look at this. Treatment may proceed without formal consent if it is necessary to prevent further harm. The location matters, right? She's unable to give consent, but she's also in the emergency department. She has a fractured leg. So in this case, she certainly cannot exercise her autonomy, be able to make choices, and she doesn't have the capacity to do it, so she can't exercise her agency, right? She can't do it. You have to put something like that down. So she's unable to do it. But because she's in this situation with a fractured leg, it's going to happen regardless. Okay, let me keep going. Number four is about emotional intelligence. You have the emotional intelligence with you. The question, though, is all about um, what behavior is relevant to Vivian's experience. So as you look at this, phone ring, hold on a second. Um, which one of these? Now, in this one, there are two potential answers. Vivian's experience. Vivian's experience was impacted by Susie's empathy, her small bouts of empathy, the popsicle scene, and her own reality testing. She read between the lines. She knew her cancer was not being cured. Either one of those is absolutely fine. Empathy, patient healthcare professional relationship. Relationship, key. Reality testing is basically saying, okay, listen, I am no longer, I'm in a different position than I was when I first came into the um, hospital when Dr. Kalikian said you have cancer. Um, it is much more realistic now. I have gone through a lot of experiences. I've made choices as well. And so the reality for her was understanding that, you know what? Her cancer was not being cured, and she's making choices. Again, sort of exercising the autonomy as well. Either one of those is absolutely fine. Okay, number five, we spoke about this in class. You have to understand what the central theme in Pizza Ship is, which is right in the article. You need the article. Language matters. So now it's inappropriate language, and the inappropriate language that was exercised were either B or D. Pretzel kids, and he's better off to let him die. Highly inappropriate by the physician and demonstrates a total lack of professionalism. I think a couple people said lack of empathy. Absolutely, which is one of the emotional intelligence behaviors and something we spoke about as an ethics subtheme. Let's go with number six, white coat syndrome, mainly attributed to physicians, but all healthcare professionals. And it's really about the immediate trust that patients and the public have in healthcare professionals. That is the ethics theme or subtheme. Which one of these indicate this? And pretty much it's right at the beginning. When she signs the informed consent form, immediately, key thing, following her diagnosis, there was trust there. There wasn't a lot of time, and there was trust. Okay. Number seven, within the context of with, How might such behavior, the lack of overt compassion interactions with patients, even though they might be clinically excellent, how might this behavior be interpreted as professionally appropriate? And in this case, we think about in not just the grand round scenes, but other scenes as well, where they certainly the physicians or the residents appear much more cold. Um, we're talking about cancer care. Um, and probably there's no other specialty where individuals will die on a regular basis. And this really serves as the notion of overt compassion. They're purposely being standoffish, may serve as a protective mechanism. This is a key thing, right? And it makes sense as you think about emotional intelligence, as you think about, it's a choice that healthcare professionals make. So they're exercising their autonomy to deliberately demonstrate this to preserve themselves. There's all kinds of ways that you can think about this and put it in, but you have to invoke the ethics themes. Okay, a few more questions. Uh, this is where Julie comes in. It's recommended that she go through this procedure. The doctor explains risk, benefits, and prognosis. She clearly understands stuff, but she declines. If she clearly understands everything and she declines, now certainly we know that there's going to be more explanation. But at the end of the day, this is about respecting Julie's wishes, especially if she's cognitively aware, she understands everything, risk, benefits, and prognosis. Um, this is not her first round. She's been doing this for a while. But what's the ethics theme here? The ethics theme is to say, listen, as long as you understand everything, we can't force you to do things. Now, maybe her family will help her change her mind later. Who knows? But it's really about respecting autonomy. And you can already tell that autonomy and how it's portrayed in here is such a big element in this exam. All right, the concept of paradox. Paradox is really an unsolvable problem or something that wasn't anticipated. So the paradox here is related to the fact that her suffering is not just caused by her cancer, but really by the aggressive treatments intended to cure. It is the ultimate paradox in oncology care. Um, and it really means that she will become, her white blood cells will be killed, and sometimes she might die because of just infections. And so this really is, you think about the twist in this, and I think many of you did put the word twist in. It's not so much a twist in the story, but it, it's the way that her experience really sort of manifests over time. Now, in the end, she her cancers kept spreading, and so she ultimately died because of her cancer. But it became she became very progressively weak throughout this. So paradox, which she uses, um, some of you use the notion of, um, John Donne and his sonnets are the ultimate in John Donne in paradox, which is a big theme. Perfectly fine to be able to do this. Also, another example of paradox as it relates to this is Jason, who's more interested in research than compassion. There's lots of different ways that you can certainly apply this. Last one, number 10, has to do with best summarizes Vivian's experience. And really the key is the notion of C here, that it is isolation. It's an emotional toll in her clinical journey. She's isolated not just in the solitude episode, but as an individual, she speaks to us individually, like we're the only people there. And so, certainly she's going through it alone, um, but she has to experience the cancer on her own. So again, using the word experience in here, experience is one of solitude. Okay. I hope this helps just in terms of understanding the context of this exam and how to look at future exams. Now, you'll see that I've written all over this thing, okay? And what I'm going to recommend is a few things that you highlight, certainly the STEM, the questions in bold, and what's most important. But then you look at every single response. You have to have your notes in, and you have to understand, how does this connect? How can I go deeper? What am I missing? But you start by identifying what's most important. Okay, folks, let me know if you have any questions along the way. Thanks very much. Bye.